First, just orientating you to the model. This is the chin as part of the case, which will be labelled. This is the sternum. This is the suprasternal notch. This is obviously the larynx, which has some lateral movement, which is maintained if after we put our pad on. This is the trachea, which is nice and spongy. It is 6 centimeters long. We can make it longer neck by moving the case down, or a shorter neck by moving it up. But the trachea is 6 centimeters long, so that's anatomical. So the carina is here, so we can look at our tube placement after the procedure. Just orientating you to some anatomy. This is hyoid, thyroid, cricoid. Palpating from the bottom is kind of nice. You get the spongy trachea, and the first hard bump is the cricoid, and then the cricothyroid membrane here. Some people like to palpate the thyroid notch and identify the thyroid, and then the space below. Just bear in mind that in a female model like this, it's sometimes hard, and again with lots of subcutaneous tissue, that can be hard. It can be easier in a male. Just remember when you're under pressure that the biggest space is the hyothyroid space. That is the most, I guess, obvious, and people can mistakenly put the tube in this place. Remember that the epiglottis is just behind here, and the vocal cords are just behind the top of the thyroid here. So anything that goes in this space can go posteriorly down the esophagus, and obviously also damage structures here. So that's why we always recommend doing the vertical incision to be able to palpate through the skin and subcutaneous tissue to make sure you can localize the cricothyroid membrane with your finger before you cut it with the scalpel. Also, just remember with anatomy that the cricoid and the thyroid overlap, so there is some protection when we're making a stab incision and going around the other way, and there is some protection so we don't go too far laterally if we're in the correct space.